So interesting news coming out of Ontario today. Ontarian wins legal battle for public funding of gender affirming surgery argued as experimental. Very interesting. The resident known as KS only successfully secured public funding for a specialized gender affirming surgery argued to be experimental by the Ontario Health Insurance Plan. KS fought for coverage for and I'm going to warn you what it's about to say is pretty graphic, but it says it was a penile preserving vaginoplasty, a procedure that creates a vaginal cavity while preserving the penis. I'm sorry, that's very graphic. And so it all began in 2022. The individual appealed based on the Ontario Health Insurance Plan's rejection to the Health Services Appeal and Review Board. And after OHIP's further appeal, the Divisional Court in Ontario ruled in her favor on April 10th, 2024. The court ordered OHIP to cover the surgery and pay the individual $20,000 in legal costs, affirming the procedure should be included under the definition as per the standards set by the World Professional Association for Transgender Health. So very interesting here. Also very important to note that the World, sorry, let me get that acronym back up. The World Professional Association for Transgender Health, WPATH, when you go through their editions of what constitutes gender affirming care, it's not just a one-off surgery. It's a series of procedures, not just procedures, but a series of medical interventions that lead to gender affirming care, which includes counseling, therapy sessions, et cetera, et cetera, et cetera. So assuming that that will also be part of the surgery, but it's not necessarily. So here's the thing. I don't think that many Canadians are against the trans community for the surgeries that they go through. I don't think that's the case. I think a lot of Canadians are very upset in terms of the fact that this is publicly funded by the government, in this case, the government of Ontario, but this sets a precedence for other provinces. There are many things that are not covered by our public health insurance providers, and gender-affirming surgeries, maybe they only affect a very small fraction of the population. And there are other things that affect all Ontarians, or most all Ontarians, that are purposely not covered under the public health insurance plan. So here's an example. Here's a list. And forgive me, this may need updating, but this is from Ontario Blue Cross. Costs OHIP doesn't cover. OHIP is the provincial health insurance plan. Prescription drugs for individuals under the age of 65. Smoking cessation drugs. Most alternative medicine consultations like Chinese medicine, homeopathy, acupuncture, and Reiki. Physiotherapy treatments between the ages of 20 to 64. Circumcision. Dental care. Chiropractor services. Casts. Eye care, unless under certain circumstances. And then there are many services from your family physician that aren't covered. Immunizations for travel, missed appointment fees, various treatments such as cosmetic, cryotherapy, medical forms and notes, tensor bandages, splints, and other medical supplies. So we can see from this list that there's a variety of things that our current public health insurance provider doesn't cover. Now, you might be saying to yourself, there's a few things on that list that it shouldn't be covered, right? Cosmetics, right? We shouldn't be covering cosmetic surgeries. We shouldn't be covering, if you want to do Chinese medicine, homeopathy, that's your choice. It's alternative. There's a reason the public health insurance provider doesn't provide that. Maybe smoking cessation drugs, but even that, I don't know. I mean, that could be covered, right? Especially given the campaigns for smoke-free Ontario, Canada, etc. But all of that said, there are other things that I think most Canadians would say that should be covered. Dental care, eye care, chiropractic, prescription drugs, and then there are things like medical forms that you have to pay out of pocket, immunization for travel. Some of these things may seem flippant to some, but if you're on a fixed income, low income, they really do matter. Can you imagine not getting the proper bandages for your injury, can you imagine not getting the proper crutches if you break or sprain a leg or muscle or joint? I mean, there's a lot of things that are not covered, and if you're middle class income, it's not too big a deal. But if you're extremely low income, that can be serious. In fact, I did a podcast a while back with a doctor in New Jersey, and they said that a lot of low income families don't come back for checkups after they break an arm, especially young, like children, and that leads to all types of other health issues. So those are the barriers I think that affect many more Ontarians. And I don't want to make this seem like, well, there's a higher number of people, so this should be covered. But I think that's the root cause as to why so many Ontarians or Canadians might actually be against gender affirming care covered by our public health provider, because there's so many surgeries, so many medical interventions that are just not covered by our provincial health provider. And I'd have to do some research to see, when gender affirming care came in to be covered by our public health provider. But I imagine it was pretty recent, and maybe it wasn't. Maybe it's always been there, and I'm only figuring this out now. But again, it lends itself to a very divisive narrative, right? So while the intentions of the government might have been altruistic in saying we will cover your gender affirming care, the government didn't realize it causes a great divide and a rift in society, because many Canadians know that there are many procedures and medical interventions that are not covered. And so why do this when eye care affects all of us, when physio affects all of us, when chiropractic affects all of us, when dental care affects all of us? And so it lends itself to kind of a politicization, which is not fair to the trans community, and it's certainly not fair to those that feel like these questions should be asked and they're not being asked. So something the government should really think about in its rolling out of gender affirming care. What do I think the solution could be? I don't know. Now I want to level set to say that if you do go through gender affirming care, there is a series of steps you have to take. You have to talk to psychologists, doctors, etc. My assumption is that trans surgeries don't happen unless those initial consultations and appointments have been met. So I want to level set there. It's not like you could just walk in and say you want the surgery. You have to have been, I'm assuming, referred to, provided based on a whole host of previous engagements. But I also wanted to share with you one thing that I think, again, contributes to this idea that people feel like there's some agenda for the LGBTQ community, that maybe their voices aren't being heard. So the government of Ontario has the Human Rights Commission. One of the areas in the Human Rights Commission is that it is a violation of the code to not address people by their choice of pronoun. It says, refusing to refer to a trans person by their chosen name and a personal pronoun that matches their gender identity, or purposely misgendering, will likely be discrimination when it takes place in a social area covered by the code. This includes employment, housing, and services like education. The law is otherwise unsettled when someone can insist on any one gender-neutral pronoun in particular. So I think that's another reason why some people think, well, why is there this focus? Why this, not that kind of thing? And it lends itself to a very divisive province and how people view human rights in our province as well. There are many cultures and communities that are not specifically covered in the, I just lost it. Here it is. There are many communities that are not covered in the Human Rights Code who may feel like they're not being identified. And the Human Rights Code covers a lot of different groups, but perhaps there are groups that are not covered. There's a lot of discrimination towards people with disabilities, not just physical disabilities, but neurodiverse individuals. I don't believe that's covered in the code. I mean, I don't want to be speaking out of my rear end here, an easier way of putting it, but there very well could be groups that are not covered. So anyways, all this said, it lends itself to people feeling left out, excluded, and then also this group in particular, the trans community, feeling like, okay, well, their surgeries are covered. Meanwhile, I'm here with bad eyes. I need dentistry. I need physio, etc. I'm low income. I can't afford these things. So I guess I'll just not have proper glasses. I guess I won't have, the best teeth. My toothache. Man, if you've ever had like toothaches and things, you know how serious those can be in terms of just the quality of life. So, major questions for Ontarians to wrestle with. I think it needs to spark a larger discussion on what our public health service providers provide and for what purpose. I think that there's this lends itself to a larger discussion. But let's know what you think. Let me know in the